So, doctor, if we find out we have cancer, what's the next step? What are some of the more natural therapies that people can try outside of the traditional ones that you'll find at your doctor?
I think actually Ty Bollinger's book covers the vast majority of natural treatments for cancer that you could cover. He did a phenomenal job in researching it. And Cancer Step Outside the book really goes over that well and thoroughly. My strongest suggestion to people that get a diagnosis of cancer, as a physician, the last thing we want to do is send a patient to an oncologist. Because once we send that patient to the oncologist, the odds are we'll never see him again. The odds are very great we'll never see them again, and if we do, it's only going to be for a brief time. The way they work statistics is rather interesting. If you go in for prostate cancer and they do a prostatectomy, so you have no prostate gland, aside from many times being incontinent or many times being impotent, the chances are very high that that cancer is already metastasized and you're going to develop perhaps lung cancer. Well, that you will be statistically called a successful survivor of prostate cancer, even though you died of lung cancer. The one thing I would suggest that they do is go back to their primary care physician. Let the primary care physician know they have chosen a different path or no treatment at all. In the 40s, there were a few really good studies done, and I haven't seen the statistics change at all since then. You lived an average of 4 times longer if you did not get treated for cancer. So regardless of the type of cancer, go back to your primary care, buy Mr. Bollinger's book, read it, learn from it, and go back to your natural or your primary care physician and say, I've decided to go another direction. I've decided to treat it naturally. That's assuming we still can without Codex. And say, will you please take care of me? Palliative care. Ensure my life is as good as it can be. And by the way, I would like you to run the following tests. And these tests will enable you and that physician that you've chosen to monitor your progress with the cancer. The first thing you should have is called a lymphocyte subset panel. Now, cancer cells are killed and targeted by cells called lymphocytes. They're produced initially in the bone marrow. These cells can be measured. There are a myriad of them: CD3, CD4, CD8, CD19, CD57, natural killer cells. But you really want to know where your immune system is specifically for the ability to fight cancer. So you get a lymphocyte subset panel. You ask him for a hormone profile, a complete hormone profile. Now what's happened in the United States is you ask your doctor for a hormone profile, and if you have normal insurance, they'll give you what's called, in the United States, a hormone profile. It is not. They give you total hormones, and they're meaningless numbers. When you get a hormone profile, you want to make sure you get what's called a free, F-R-E-E, as in it doesn't cost anything, but it does, free testosterone, free estradiol, because those two ratios are very, very important. Once they are bound to a protein, they're no longer functional in the body. And that's why I say free. If you get a total, those hormones can be bound by, for example, sex hormone binding globulin, and they can no longer be used. So the numbers are useless. It's very similar to a hemoglobin A1C, which we use routinely, or most physicians use routinely. I never do. to monitor diabetes. It's a 30-day average of your glucose levels. Well, type 2 diabetic will be 300 and then drop into the 40s, and then go back up to 250, and then drop back down into the 40s. So what good is an average?
30-day average doesn't tell you much.
It doesn't tell you anything. If it's high, then you know you've got a real problem. However, if you go to the doctor's office and you just have a blood glucose level taken, fasting, that will actually tell you a great deal more. And if you do it 3 or 4 mornings in a row, you can get a really good handle on where you're standing. Where the lab test that they use is rather useless. An awful lot of the lab tests we use in medicine are useless, waste of money. A total hormone profile, as I said before, you know, total numbers, they're useless. They don't mean anything. It's only the free hormones that are able to have an action that mean anything. And there are real misconceptions in hormones. We all have the same hormones, men and women. All have progesterone, estrogen, testosterone. The only thing that's different are the ratios. So make sure you have a lymphocyte subset panel, a hormone profile, a complete blood count called a CBC, and a CMP, comprehensive metabolic profile. And those will give you your liver functions and your renal functions. And ask your doctor to monitor. And if he's free to do that, he can give you a much better quality of life. They don't want you to go to the oncologist, but they are obliged to send you to the oncologist if they believe it may be cancer. You are not obliged to stay with the oncologist.